Good afternoon, dear patients. Today we will discuss a case of redness of the glans penis and the lips of the urethra after anal sex. A man came to us who had unprotected anal intercourse. After that, literally the next day, he began to experience itching in the urethra and redness of the glans, especially around the urethra. For a long time he washed everything with myramistin, rinsed it, and washed with soap. However, this did not completely help. Only the discharge that this man had almost completely disappeared. If you look at the picture at the time of his visit, there was visible redness around the urethra on the glans and redness of the lips of the urethra. A smear for flora was taken, which revealed inflammation. There were 20 to 25 leukocytes. Cultures for bacteria were also taken, which identified E. coli and enterococcus. Well, all tests for sexually transmitted infections were taken and they turned out negative. Accordingly, indeed, after anal sex, the flora that inhabits the anus often gets onto the glans and into the urethra of men. It causes a natural inflammation there. Even with prior washing, it is naturally impossible to achieve complete sterility. And E. coli and enterococci are supposed to live in the anus, but they definitely should not be living on the penis. Naturally, it is not uncommon for them to settle there and cause inflammation, as happened in this case. The problem is that these inflammatory reactions are caused by the body's natural microflora, but microflora that lives in the anal area, and when we eliminate it from or on the penis, we end up causing dysbiosis in the intestinal area. That's one. Secondly, the problem is that these bacteria often cause and sustain prostatitis. Indeed, when it comes to the causes of prostatitis, the leading role is played by E. coli and enterococcus. What was done for this patient? This patient was diagnosed with urethritis and balanitis, specifically of bacterial origin, meaning caused by bacteria. What was done? First, injectable antibiotics were prescribed, administered orally according to the sensitivity of these microorganisms to antibiotics. Urethral irrigations were performed. Ointments with antibiotics, such as levomethil, were prescribed. Longidasa was prescribed as an injection. And in addition, medications like canifron were prescribed in order to, let's say, increase the volume of urination, first of all. In the second place, the goal is to significantly boost and enhance the concentration in the urine of various therapeutic medications that possess strong antibacterial activity, even if they are primarily derived from natural plant origins. As a result, this redness, itching in the urethra, and other symptoms disappeared in this young man within 5 to 6 days. The course of treatment lasted 10 days, after which follow-up tests were taken, which showed, first, the absence of leukocytes, second, the growth of normal staphylococcal microflora in the required concentration. Therefore, if you practice anal sex, it is advisable to use a condom or immediately after such contact to carry out various hygiene procedures which will reduce the likelihood of developing similar bacterial urethritis or balanopostitis caused by intestinal microflora.